Hello and welcome. I am Ronnie Snyder. I'm the acting president for the John A. Hartford Foundation, and I really want to thank you for joining this briefing today on the Older Americans Act. I'm going to make a few brief remarks, and then I'm going to turn it over to our expert panelists for their insights. We plan to spend a lot of our time today responding to your inquiries. So please feel free to submit questions at any point by using that Q&A feature that's located at the bottom of your Zoom screen. The John A. Hartford Foundation is a nonpartisan national philanthropy that is working to improve the care of older adults. We focus on three different overlapping priorities: expanding age-friendly health systems and the availability of high-quality age-friendly care, increasing support for family caregivers, and improving serious illness and end-of-life care. Our program staff have deep expertise in all of these areas, and we work closely with a robust network of grantees and partners, all of whom can be a resource to you and some of whom you'll meet today. We don't take positions on specific legislation, but we do seek to educate lawmakers and other people about the potential impact of certain policy decisions on older adults and their family caregivers. So today, we're focused on what's at stake in reauthorizing the Older Americans Act. It's a major piece of aging and health legislation that was first passed 60 years ago, along with its well-known counterparts, Medicare and Medicaid. And while Medicare and Medicaid pay for health care and long-term care services, the Older Americans Act funds services that are equally essential to health, and we'll be talking about that. So if you're thinking about your own parents, your grandparents, maybe other older relatives or loved ones, these are the kinds of services that ultimately are going to keep them healthy, safe, and connected to their communities, where by and large, we all want to age. The Older Americans Act provides funding to community-based organizations that deliver things like meals to people's homes, serve food in community centers and church basements, provides transportation to medical appointments, and gives support to family caregivers. And also offers a variety of other really important services, including to American Indian and Alaskan Native elders through specific support for tribal organizations. Through this variety of services and programs, community-based organizations help improve people's health, ultimately avoid the need for nursing home whenever possible, and foster really vital social connections. Because community-based organizations understand the local culture, the local population, and ultimately the most pressing needs of their own specific communities, they're really well equipped to provide the specific interventions that help keep older people living independently. So local intervention and care are what the Older Americans Act has always supported, and they're a big part of why it's been so successful. This is particularly needed now in anticipation of Medicaid budget shortfalls and cuts to state-led programs that support older people and their caregivers. States can stretch their dollars as far as they're able, but there's only so much that they can do, and they need support as well. So we're going to learn a lot more from our panelists. But before I introduce them, I want to acknowledge and thank a couple of other organizations that aren't represented on our panel, but that also have dedicated significant resources to educating people about the Older Americans Act. And they include Meals on Wheels America, as well as the National Council on Aging. Okay, let's meet our panelists. Amy Gottwals is the Chief of Public Policy and External Affairs at U.S. Aging, which is an association representing the national network of area agencies on aging in local communities. Abby Cox is the Senior Director of Aging Policy at Advancing States, which is an association that represents the nation's 56 state and territorial agencies on aging and disability services. And last but not least, Bob Blancato is the Executive Director of the National Association of Nutrition and Aging Services Programs, which is an organization for people who provide older adults with healthy food. He's also the National Coordinator of the Elder Justice Coalition. And frankly, Bob has been just a stalwart in aging policy. So a quick reminder to please submit any questions you have using that Zoom Q&A feature. And let's start with Amy. Amy, welcome. Can you tell us a little bit more about the Older Americans Act and the role it plays?
Absolutely happy to, Ronnie. Thanks for having us, and ready to talk about my favorite piece of legislation ever. And hopefully we'll have a few new fans walk away from today's conversation. So on the next slide, we're going to go back in time to 60 years ago when the Older Americans Act was first signed into law by then President Lyndon Johnson in the summer of 65. So we just a few months ago had the 60th anniversary of this act, and it has held up well, and doing amazing things, even more than perhaps they could have envisioned 60 years ago in communities around the country. On the next slide, I'm going to point out some of how we're doing so much more. And that has really been thanks to engagement on both sides of the aisle for decades in this particular act, in the network this sets up, and most importantly, in the ways that real older adults receive services and get help to be able to age well at home and in the community. You'll note that 1965 was a pretty big year for policy, with both Medicare and Medicaid also passing that summer. So the Older Americans Act is part of that Great Society legacy as well. Difference is we are smaller in scale and, unfortunately, in funding amount than those two flagship programs that are so important to older adults for long-term care under Medicaid and, of course, healthcare under Medicare, but because we are on the discretionary side of the budget. So you can see here just a couple of highlights. There'd be so much more if you want to dig down into the legislative history of the Older Americans Act, but you can see that over time, some of our core programs were added. One type of meals provided from pretty early on. Innovations in the field lead to, oh, well, my goodness, let's build out a part of the act that can address this particular need, people who cannot come out for nutrition in the community, for people who need help from being evicted, and legal services for caregivers of older adults and older adults who are themselves caregivers. So over time, the act has been updated and modernized by Congress in reflection as to the great innovations in the field, as well as the needs of older adults and caregivers. And I know Bob's going to talk a little bit later where we stand in our current reauthorization, but I will point out that the last authorization was completed, signed into law by President Trump in his first term, and it was March 23rd of 2020. We got in at a critical time, as certainly we were all dealing with quite the other crisis. So next slide, please. So I'm going to drill down into some of the key services in the Act, but save a few of those for my colleagues to go deeper as well. But when you look at this, we use this image really speaks to not all, but many of the core services in the Older Americans Act. So we're talking about nutrition programs, ensuring older adults are receiving nutrition and anything that changes as they age to prevent malnutrition, to prevent poorer health outcomes, and also just because they're hungry. We need to help them stay well and age well in the community. A key part of being able to do that, though, is also other supportive services, which I'll detail in a moment. I've already touched on family caregivers. Know that since 2000, that's been an important priority population for the Act, and there's only increasing need as the number of family caregivers around the country grows. There's a health and wellness component we'll talk about, and then Bob's going to speak at the end to some of the elder rights provisions. So next slide, please. All in all, there are 7 titles in the Act. Quickly tell you, Title II is the federal part of the aging network that Abby's going to walk you through, kind of how we get this work done. But know that the federal agency in charge of this is the Administration on Aging. Now, it sits within the Administration for Community Living, which is in HHS, but it is got an Assistant Secretary for Aging. That is Senate confirmed position, reports directly to the HHS secretary. So this has got a lot of history here, as you can see, and sets up a wonderful federal partner for all of us in the Aging Network to be a leader within the federal government for aging Americans and those who love and support them. Title III is the bulk of the Act as far as those annual discretionary funding and the types of programs that are authorized. This money goes, Abby will talk about more, to her members members and then down to my members and then out to work with community-based organizations in the field. But here are the key subtitles of this act that we're going to talk about: the supportive services, the nutrition program, the evidence-based health and wellness programs, and then family caregivers. Next slide, please. I want to drill a little bit more into a title of the act that often is less understood. It's because it is the most flexible pool of funding. So it's most valued by our members because they can do so many different things with it and best respond to the local needs they're seeing in their communities and adapt to where they might have other resources for a program, but don't have other support for X, Y, or Z service. And so this is a wonderful, important program within the act. So some of the things that then area agencies on aging use this funding to fund is that in-home support I mentioned. That's why the bucket is called supportive services, and in the law it's in senior centers, because that's also important mechanism for community support, but it's help in the home. It's transportation, sometimes to other programs in the Older Americans Act, such as a ride to that senior or community center where a meal is being offered to older adults. It's also chore services and home modifications. These are all service options that not everybody needs. Not at all. This is not a one-size-fits-all act in any way, shape, or form. But if we are going to meet our mission of helping older adults be able to stay where they want to stay, which is usually certainly in their home, but often in the home they have lived in a long time. Sometimes you need to make adaptations. You need to pull up the throw rugs. You need to add some grab bars. You need some help with that annual fall raking in order to stay safe and aging well in your home. So those are just some of those very concrete services that the Older Americans Act makes available in communities. I've mentioned senior centers already. That's another important hub for many of these other activities. We really work as an entire network and can deliver services in whatever setting makes sense in that community. And there's a lot of overlap between these programs in the sense that they are synergistic and engaged together. And we are a frugal network that is always ensuring how we can best maximize the most services to the most people. Another through line I want to quickly point out, but there is ability to, in Title IIIB, to fund social engagement activities. So critical to address the often social isolation, loneliness that older adults unfortunately experience in large numbers often as they age, not everyone, of course, but how we've learned more and more how important it is to keep people staying engaged in whatever way they see fit, but our network also helps support that. And that's not just limited to Title IIIB, that's a key component of the nutrition programs, as well as many other titles of the Act. I just want to flag it here because this is also the title that can fund a lot of innovation very dedicated to that we saw happen in COVID. So next slide, please. Lastly, on 3B, I want to read you into something that is lesser known until you need support from this network, which is the fact that Title 3B also funds information referral and assistance. This is how people in the community, whether it's a family caregiver, a worried neighbor, an older adult themselves, actually figures out what is out there, what's available in their state, what's available in their community, and what it's like to even ask for help with these things. People are often reluctant, so we want to create easy ways for them to tap into programs they might be eligible for, whether Older Americans Act or others. So there is an information and referral assistance systems in every state, and then again at the local level, at the AAA level. So here's just some examples of the kind of direct support. And the photo is not a stock photo. This is a real AAA area agency on aging nickname there, actually providing this support over the phone. So next slide, please. If you're not sure where to start, what the state unit on aging is in your state or the area agency on aging in the state, know that the Administration on Aging, under the direction from the Older Americans Act, funds a national call center. It's called the Elder Care Locator. Here is all the ways you can contact it. We do live web chats as well as, of course, a full call center. US Aging does operate this center under a competitive grant I wanted to disclose. So you could always start with the Elder Care Locator, and they're excellent at helping people get to where you go and then out into the field. Next slide, please. I think I'm almost past time, so I just want to reinforce, because Bob's going to speak about nutrition, that there is a whole subtitle on the Family Caregiver Program. And if you're wondering what that is, that's respite, it's support groups, it's caregiver training, other ways to shore up the family and friend caregivers that are the backbone of our nation's elder care system in America. And then highlight that Title III-D has that evidence-based programs. You may know them as chronic disease self-management programs or hear about falls prevention programs. This is a very small pot of money to go nationwide to help support these activities at the local level. So next slide, please, and then I'm about ready to wrap this up. Oh, but I don't want to be remiss in not mentioning these other important titles of the Act. There is a workforce training and community service program for low-income older adults who need to work and need some help with skills training beyond. Title VI is the programs that Ronnie mentioned, where tribal aging programs to supplement the work that's already being done for all older adults under the Older Americans Act. And that's something our organization cares a lot about. And I'm leaving Title VII to Bob. So with that, I think my next slide turns this on over to my colleague, Abby Cox.
Fantastic. Thank you, Amy, for that overview. I love the timeline. I love the detail so that people really understand the breadth of those services. As we move to our next presenter, I want to remind folks to go ahead and use that Zoom Q&A feature. And let's see. All right. I'm going to turn it over now to Abby for information on the return on investment of the Older Americans Act and other thoughts. Welcome, Abby.
Thank you, Ronnie. It's so good to be here. Amy, thank you so much for that great background so that hopefully now we're all aware of the types of programs and services that are made available under the various titles in the Older Americans Act. And before I jump into my slides, I just want to take a moment to just make sure that we're all aware that that many of our older adults who are enrolled in Medicaid often have chronic conditions and more complex health needs, which oftentimes leads to higher costs. And so I want us to think about the Older Americans Act as that pre-Medicaid, before an individual goes on Medicaid. These are the types of programs and services that our networks might be able to provide so that that individual stays off the rolls of Medicaid. And if done right, we're serving the right individual with the right services at the right times, and thereby serving them in a more cost-efficient manner and delaying that onset of Medicaid. And the last time that I checked, individuals wanted to remain in their homes in the communities. And so that's what the beauty of the Older Americans Act really is. So our network is really great about telling some amazing stories of the individuals who are served with the Older Americans Act programs and services. But we are learning collectively to talk in terms more of our return on investment for the Older Americans Act. And this is really important because there is a big ROI story to be told. And so this slide really depicts many of the more common programs and services that Amy just talked to us about that are made available through the OAA. I do just want to say that these infographics are at the national level, and we'll be providing you with a link so that if you're interested in what the ROI for a particular state is, you'll be able to access that. But this again is at the national level. And so what you can see here is that we've got the states that are clearly serving high volumes of older adults, like California and Texas and Florida. You can see how many meals were provided, trips completed, connections to local support resources, even hours of personal care. And this is all for the fiscal year 2024. And if these numbers don't just truly blow your mind, then let's take a look at the right side of this slide. And we can see here that the Older Americans Act programs achieved an estimated $8.9 billion in cost savings by reducing the need for institutional care, and instead serving these individuals, again, in their homes and in their communities. Better said, for every OAA dollar put into aging services, the OAA generates for every dollar, the OAA generates $3.39 in community value and taxpayer savings. So these are really big numbers that we really need to pay close attention to. All right, let's look at the next slide as we look at the structure of our aging network. This can oftentimes be very confusing. People don't know much about the Older Americans Act, and they certainly don't know how we are structured. So Amy opened up her comments talking about how the Older Americans Act is administered by the Administration on Aging, and through an interstate funding formula, they provide funding to our state units on aging. And so we can see here that we've got 56 state units on aging, and we have 291 tribal organizations. I want to just pause there to make sure everybody is aware of the supports that are available to our tribal organizations. And this is under Title VI of the Older Americans Act. And these grants support American Indians, Alaskan Natives, and Native Hawaiians in the areas of nutrition, supportive services, and caregiver services. And they receive formula grants allocated based on their share of American Indian, Alaskan Native, and Native Hawaiian populations age 60 and over in their service area. And to be eligible for that funding, tribal organizations must represent at least 50 Native American elders age 60 and over. So I did want to make sure everybody is aware about the ways in which we are supporting our tribal organizations as well. But our 56 state units on aging, in turn, many of them work with a network of area agencies on aging, and they provide funding to them through an intrastate funding formula. So largely speaking, the number of people 60 and above in their local areas. And they've got a funding that is weighted, and it's based on those in greatest social and economic need as defined by the state. And so those area agencies on aging turn around and they contract with more than 21,000 service providers. So these are your local business owners, your local community-based organizations who are directly providing these services like our meals and transportation services to older adults who are in need. But this work would not be possible without our amazing volunteers. And we have more than 80,000 volunteers in our network that are delivering meals, making sure that we're combating social isolation for our older adults. And this work really is critical because not only are they an extra set of eyes and ears in the community and engaging with individuals, but they're providing many of the critical services to get these really critical programs in the hands of older adults. So I wanted everybody to walk away aware of the breadth and reach of our amazing network. And then at the bottom here, you can see just a snapshot again of how individuals have been touched by the programs and services that are made available under the Older Americans Act.
Thank you, Abby. That's great. I love the map you included. And I really want to put an exclamation point on the point you mentioned about, I'd say almost $3.50 of savings for every dollar spent, because that's certainly of great interest in the current environment. All right, Bob, it's great to have you here. Would you do us the favor of sharing now how the Older Americans Act supports two programs close to your heart, nutrition and elder justice, and also just give us an update on the Act's reauthorization?
Wonderful, Ronnie. Thank you so much. And let me also thank the John A. Hartford Foundation for hosting this. And I am extremely impressed with the high turnout here today. It's encouraging to see that. And let's go to the next slide. So I'm going to talk first about the largest program in the Older Americans Act, which is the Nutrition Services Program. Congregate meals. Now, home delivered meals is one term, but Meals on Wheels is the term most everybody knows. It's got one of the best brand recognitions of any name of any federal program I know of, and also the Nutrition Services Incentive Program. The program targets older adults who are in the greatest need. It serves family members and caregivers. It includes healthy home-delivered meals and meals served in group settings, but also provides nutrition counseling and screening, and it connects participants with home and community-based services, and serves more than 2 million adults, older adults every year. Next slide. Continuing on the theme from what Abby just talked about, It is a smart investment, okay? And let me point out the difference between the Older Americans Act Nutrition Program and the SNAP or food stamp program. It differs by providing nutritious prepared meals, socialization, and other services. Or put another way, it is more than just a meal. All adults 60 plus are eligible, but targets those in the greatest need, especially those with low income, food insecure, and rural communities. It too has a wonderful return on investment of 4-to-1. And during the pandemic, the importance of this program was rewarded by having a doubling of its normal funding during the pandemic. As you can see on the right, the participants who are asked say the meals help improve their health, the services make them feel more secure, and most importantly, the meals help them live more independently. Next slide. As Ronnie mentioned at the very beginning, we have a Title VI Native American program in the Older Americans Act, and it has its own nutrition services program. Tribal elders receiving OAA meals reported 36% fewer hospital visits, 10% fewer falls, 35% more social activities per month. And very importantly, from a cost saving perspective, elders who were served in this program with higher number of services reported fewer hospitalizations and fewer falls per year. And we're very pleased this program now serves almost 3 million meals each year under the Older Americans Act. Next slide. The other topic that I am to talk about is Title VII of the Older Americans Act, the Vulnerable Elder Rights Protection. It includes funding for an authority for the Long-Term Care Ombudsman Program, which advocates for older adults in nursing homes and assisted living, which has received almost 200,000 complaints and resolved 75% of them. And once again, as in so many other programs in the Older Americans Act, volunteers are key to the success of this program. We also in Title VII have elder abuse prevention programs, which includes important grants to adult protective services, who receive nearly 1.4 million reports of adult maltreatment in their community. It leverages $9 in non-OAA funds for every $1 of funding. We also have elder rights and legal assistance development in Title VII with the National Center on Law and Elder Rights. And we have Tribal Elder Justice Program and also the National Center on Elder Abuse. Next slide. So this was a very appropriate title of this webinar. What is at stake with the reauthorization? In my judgment, the answer is a lot. Let's look at modern history. Let's look at last year. The Older Americans Act was due to be reauthorized and came very, very close. The Senate early in the year produced a bipartisan, forward-looking 4-year renewal that included input from advocates. The Senate and the House came to a last agreement late in December, but the House just failed to act before the clock ran out on the session. And in my judgment, one of the consequences of having this law not be reauthorized was it allowed it to be part of the major reorganization of the Department of Health and Human Services, which was announced earlier this year. Next slide. So actions in 2025 with this reorganization, it ultimately transferred Older Americans Act programs from the existing Administration for Community Living to a new agency called the Administration for Children, Families, and Communities. Now, among the choices from the original plan on reorganization, this was the best. And the 5 organizations that came together, U.S. Aging Advancing States, NCOA, NANASP, and Meals on Wheels America, we felt this was the best place for all the Older Americans Act programs to be, and we're very pleased at that outcome. So next slide. As we talked about, we did celebrate as a community, as organizations, the 60th anniversary of the Older Americans Act. And we go to the next slide. And we're very pleased that we are making some progress on reauthorization so far in this Congress. S 2120 has been introduced by Senators Cassidy and Sanders with the following senators there as co-sponsors on a bipartisan basis. It extends the program through 2030. It increases authorizations for most programs over the life of the bill. It maintains some of the key nutrition flexibilities that occurred during the pandemic. It will focus on medically tailored meals being available in the nutrition program. It also clarifies how area agencies can provide Older Americans Act and non-Older Americans Act programs. It adds elder abuse training to the National Family Caregiver Support Program and elevates the long-term care ombudsman position as a full-time position. Next slide. So how does 2025 change the reauthorization? What is at stake? Well, the first thing, we got to figure out how this reorganization is going to impact the Older Americans Act reauthorization. Either it will or it won't. It's hard to know until we have more clarification on the new agency. But on another note, we're very pleased that the opportunity to show the nexus between nutrition and healthy aging and good health can be recognized now more with things like the Make America Healthy Again than at any time in the history of the Older Americans Act. So between the Making America Healthy Again and the new physician fee schedule, which may offer the first time Medicare reimbursement codes for social care, there's so much interest in that over 190,000 people commented on that proposed rule from Centers for Medicare and Medicaid Services. So let me say two more things. The next slide. The scenarios for 2025 on the Older Americans Act. The best way to say the House's situation is they seem to be planning to introduce a bill, and we're waiting to see what the bill looks like. The next steps could be hearings in the Senate Health Committee and the House Ed and Workforce Committee. If the House follows the Senate bill, that's the fastest way to get passage. And there will be two possibilities there. One, you could have a separate bill passage in the House and Senate by unanimous consent in the Senate and under suspension of the rules in the House because it'd be considered non-controversial. Or you could move it into an end-of-year package. That's if you follow the House joining the Senate bill. If it's a different bill, it could complicate the process a great deal. And we're waiting to see what the administration has to say about it, which they haven't been commenting yet. And, you know, September is a very pivotal month and will be October as well. We want to see the House make a move by having the first set of hearings led by Chairman Walberg of the Education and Workforce Committee. So finally, action is needed. Okay? The 60th anniversary for a program that has succeeded in every way measurable. It has value both to the older adults and their families and to the federal government through savings it achieves to Medicare and Medicaid, numbers that Abby pointed out in her slides. Advocates have a great story to tell. The Older Americans Act is easy to localize and humanize as an advocate. We know the best known programs can help make the case. Meals on Wheels, supporting caregivers and elder abuse prevention, and having 613 area agencies on aging, meaning there's likely one in every congressional district. Clearly, it is time to move the Older Americans Act reauthorization process. Thank you very much.
Thanks, Bob. That was great. I love the tagline that the earlier part of your remarks suggested, nutrition, more than a meal. I also really am focused on how bipartisan support both is and should be of these kinds of services in all of our communities. Okay, so as we've heard, the services supported by the Older Americans Act are just incredibly important. And the John A. Hartford Foundation knows that American taxpayers recognize that, even when they don't really fully know what the Older Americans Act is. And the way we know that is that the John A. Hartford Foundation partnered with the nonpartisan research organization NORC at the University of Chicago, sometimes called NORC, to survey U.S. adults about the support that they may have for programs that the Older Americans Act makes possible. So we're still renewing the findings and we're going to release them soon, but I do get to give you a little bit of a sneak peek. Our findings so far show that the vast majority of people support the types of services provided by the Older Americans Act: meals delivered to homes or in other congregate settings, transportation to medical appointments, and ultimately support for family caregivers as well. It also shows that people are willing to use their tax dollars to support these services. So I'm going to give you a couple of quick stats. 4 out of 5 people who we interviewed support using tax dollars to fund programs that prevent elder abuse and neglect and exploitation. The same amount, 80%, support using federal tax dollars to help older adults age in their homes, which overwhelmingly we all would prefer to do, instead of nursing homes. And then finally, fully 84% of people believe the Older Americans Act should continue to be funded through federal tax dollars. 84%, I'm just going to stop there for a second. I'm not sure the last time I've heard 84% of people agree about anything. So we're going to look forward to sharing the results via email. And if you're already on our mailing list or if you opted in when you got on this webinar, you're automatically going to get those. If not, you can sign up via the link in the chat. But what I really want to do now is go to some of the questions. Let's see. Okay. Oh, and by the way, a reminder to submit questions using the Q&A feature on the Zoom screen as well. Okay, the first question I've got here is, do you have a very brief anecdote of real-world implications for Older Americans Act supported programs in action? And I think I'm going to start with you on this one, Amy.
what it looks like when all of this verbiage and legislation meets the person. Okay.
Right.
That was what I ran out of time to do. I had all those handsome faces of older men and women and their caregivers on that last slide, because what I wanted to impress upon is the fact that, yes, they're very much real people from real families in communities who end up getting this type of assistance. It really, if the network is doing the great work that they do every day, and many of them are on this call, so shout out to you all. You do the hard work. We just get to brag about you. But what I want people to understand is they meet the person where they are. What is that situation? People often will call our local members, or the Abby's members may get to the state level. I'm desperate. I need a ride to the doctor on Thursday. I can't make my rent anymore. People call in crisis. And so this network then responds and fills that need temporarily, and then works with that individual or family to figure out what else they might need to age well at home in the community. You're meeting them. This is not, it's discretionary funding. So those who know the difference of discretionary and mandatory, we don't have much money to do this funding, which is why there's so much leveraging of funding at the state and local as well, with the federal as a bedrock. But what people are able to do then is be flexible in offering those services. You get what you need, not just what somebody has decided this is the services you need. Most people don't want to take on more than they need. They're often scared to ask for help, don't want to feel like that will somehow inhibit their aging instead of support it. So that's really what it is. Whether it's Mrs. Gonzalez or Mr. Wells, these are real people in the community who rely on that delivered meal, that ride to the doctor so they can ensure they are getting to chemo, and their case manager who is helping them manage all different programs, the people helping them enroll in a Medicare plan by offering a lending year, someone who came into the home and gives them their shower. This is really these services. There's no fluff along the way. This is going straight into helping people stay at home in our community, not only because that's what they want, but this benefits taxpayers. If everybody did not get this help that the Act provides, first, they'd be less healthy. There wouldn't be the prevention of wellness. And then also, if they aren't getting these services at home, they will not thrive and may not survive. And then it turns to those institutional options of nursing homes, which certainly is important, but not the right fit for everyone. And it will cost taxpayers more. So sorry, that was really long. I'm really passionate about this.
I love the passion. That's great. Anybody want to jump in before I go to the next question?
I would love the opportunity, because one of my favorite stories from when I ran Georgia's State Unit on Aging was a story out of one of our rural areas of the state. And it was an older woman who had been coming to the senior center devoutly. And she lived alone at home, and she really enjoyed coming to play cards with her friends. And oh, by the way, she was getting a meal while she was there as well. And it was a chance for people to have eyes on her. And she stopped coming, and people got very worried about her, and they checked in on her, and she had been in and out of the emergency room. She had arthritis, and and it was leading to some other issues. And so she was feeling embarrassed that she couldn't hold her cards up at the senior center. So she had stopped coming. So what we did was we spent like 5 cents on one of those foam pool noodles that could cut a hole in it. It could hold up her cards, and she could come back to the senior center, engage with her friends, get that important nutrition, get her out of her home. For 5 cents, we got her back into the senior center and active again. It was one of my favorite stories.
That's a great story. Ingenuity in community. That's fantastic. Okay, I'm going to move to the next question. And Bob, I'm going to toss this one your way. This is a question about the Administration for Community Living. What is the status of ACL?
Well, at the moment, the status is proposed to be placed into this new agency called the Administration for Children, Families, and Communities. Almost every program of the current Older Americans Act would end up in this new agency. There are not a lot of details about this new agency. I do know that the 5 aging organizations I mentioned before advocated very strongly that among the 3 agencies that were going to put ACL in, the one they should have ended up in is the one they're in, which is the Administration for Children and Families. The next advocacy strategy for us is to make sure there's dedicated aging leadership in this new agency, because as Amy pointed out, there are statutory requirements for the positions that exist in the Older Americans Act. They must be respected and honored. And we want to make sure that those positions and ACL is absorbed nicely into ACFC. And actually, there could be opportunities within that agency, since some of what the Administration for Children and Family already does touches the Older Americans Act, like administering the social service block grant and programs like that. So we are optimistic, and we are continuing to do advocacy with the administration to make sure this is a successful outcome for older adults, which is the most important part of this question.
Absolutely. And I do like the optimism too. Okay, here's the next question. In advocacy work, are you finding that making the ROI case is effective? And do you find them accepted on the Hill? And that one probably is more for Abby because you raised it, but interested in your thoughts.
Yeah, I really appreciate it. We have heard really positive remarks of now developing ROI infographics. And what's really great about the ones that we have, they are available to every state. The methodology used is applied to every state, so it's more of an apples to apples approach. It provides a great way to engage with members on the Hill about how critical our programs are, but in a very different way. And I think that this was really needed in us telling the story of the Older Americans Act. I know a lot of states are also doing additional ROI deep dives that would go well beyond what we have here, but we're really pleased to be able to provide this both at the national level and at the state level so that we can really enhance those conversations on the Hill.
And it's what people want to know.
That's
So
right.
Really important.
That's right.
Thank you. All right. I'm going to move now back over to Amy. This is a question about what challenges states and communities face in implementing the services.
Oh, we don't have time for all that. Let's do the federal piece. These programs are woefully underfunded. They obviously are on the wrong side of the ledger where you want to be if you're going to have an increasing population over your 60-year history. This is unprecedented, as you said, the demographics here. This network has to rely on a 5-cent solution because we do not have all of the resources that are needed to help those who are in communities right now. And we don't always have all that data. I'm going to answer a question I peeked in that chat. Our states all keep wait lists the same. No, they don't. So our AAAs and community providers and certainly states have a real awareness of who they're not able to meet the needs of with this limited funding. And that now is certainly not growing. We're all grateful that the all but one program has been proposed for cuts in the House and Senate appropriations measures that are currently, all eyes are on the continuing resolution instead. But at the same time, ongoing non-growth of federal funding is the number one issue that I hear about from our members. They, by and large, have some pretty good flexibility because of the statute. They all know what they're doing. These are experts at every level, throwing their lives and professionalism into helping these people. But the stagnant federal funding makes it hard to then leverage additional state and local dollars. So that is largely the biggest obstacle that I hear consistently, and I hear it from all layers of the network too. Jump in.
And Ronnie, if I could add, what you brought up earlier, the question about the cuts in Medicaid and SNAP that are forthcoming are going to intensify the pressures on the Older Americans Act and the Aging Network. And to the point where there will be a compelling case for why more funding is going to be needed, because they're going to have people coming to them that have not come to them before. And at this point, if we have 1 in 3 nutrition programs with waiting list, anything more than that's going to create a tremendous need for additional funding.
I think that is such an important point, Bob and Amy. There will be increasing pressure everywhere based on current outlooks, and increasing demographics are only a piece of that right now. Okay, so I've got another question here. This one's probably more for you, Abby. Are U.S. territories like Puerto Rico included on this? And, thinking about the fact that territories tend to have greater rates of poverty than the continental U.S. and high rates of food insecurity kind of feeds into that question.
It's such a great question. And we do have our territories reaching out and asking for help, really leaning in. We're providing a great forum for them to be able to come together and talk through a lot of the solutions because they are seeing a lot of individuals. The Older Americans Act serves people 60 and older and greatest social and economic need. They have a lot of individuals that would fall under that category. So they really are in a unique position where not only do they need extra support, they're different from the way our states operate, but also the funding just is not there to be able to serve the large number of people coming through their doors. And Amy, I don't mean to pun it to you, but I don't know what it might look like at the local level.
Yeah, I think when I travel and talk to AAAs in different states, you hear the same thing, that lack of funding, but here's also what's true. Every single state is aging, and almost always at rates that they've never been aging before. So this is a victory for a long life and longevity, but it creates a challenge because living longer means you're greater likelihood of needing these services at some point. Some states, however, their aging populations are growing at a faster clip than others.
Yeah.
So when Congress level funds a program, when they go to allocate that funding according to the formulas under the Older Americans Act, if that is exactly the same 410 million for Title IIIB for all of those states and territories to divvy up and trickle down to the community, then if Colorado's aging rate is faster than Iowa's, even though both have more older adults that they had before, then Iowa ultimately loses some of that funding to Colorado. Now, that's just a neutral statement. That's the fact of how it works, which is just another reason why we need to, of course, finish reauthorizing the act. There's important changes to the law that need to be made, but also, at the end of the day, it's the funding that matters most, because this is not this is a pain point. Aging as both a wonderful solution opportunity and a challenge economically and from a service provision and caregiving standpoint is something that 100% of Americans are affected by.
And one last piece I would just add to that is when we were in Puerto Rico and talking about some of their unique challenges, what we heard loud and clear was that many children and grandchildren moved to the United States. So you've got older adults who are living in our territories, which is a wonderful thing, but just maybe at a greater risk because they might not have the familial social supports available to them.
Yeah, that's really important. And that's true of a lot of rural areas, actually, in addition to Puerto Rico. That's one of the reasons I really liked the map that you put up, Abby, because you can see that some of the really big states were very dark, meaning they had higher proportions of older Americans. Like I saw California and I saw Texas, but I also saw Maine, which is my home state growing up. And my mother reminds me constantly, it's the oldest state in the nation, depending on how you cut the numbers. So it is unequal across the states where you're really seeing some of these results. Okay, I've got another question. This one's for you, Bob. So it's actually a really good question about sort of what are the issues debated at the Senate or the House that could ultimately prevent reauthorization? Is that something we're worried about?
Well, I don't want to be a prophet of doom. It's not my nature to do that. But, funding could be an issue. Level. I mean, there are differences of opinion, I think, between the Senate and the House informally on how much you should increase funding. You've got some people who believe that the eligibility age of 60 should be higher in the Older Americans Act, which disenfranchises many older adults if you went that route. I also think that, you've got people who don't completely understand, and this is something which I want to give credit to U.S. Aging for doing, which is, a lot of our older adults come and enjoy the services that we've all talked about, yet they don't know the program that provides it.
Right.
Right. And had we done a better job of educating these older adults earlier in the process, they could be the best advocates we have when they walk in and say, thank you for this meal. This is wonderful. Thank you for the Older Americans Act. And so I think the answer to things that could be controversial could be remedied if, on a bipartisan basis, every single member of Congress took a visit to a senior center took a visit to a home delivered meal program, took a visit to an area agency, met the people, saw the older adults themselves, and see that it's actually a community-based program and it's in their community, which will change the dynamics of the conversation. So I remain optimistic that we can have more agreements than disagreements in a reauthorization, but we're prepared to educate and inform to the full extent possible any members who have questions and staff who have questions about what the Older Americans Act means to them.
That's why we're here today.
And if
Go ahead,
I
Amy.
can jump in, we did this exercise in 2024 as advocacy organizations, as folks in the field who are on this webinar, who did a lot of outreach to members of Congress. Some of you on the call might be in those members of Congress offices and you received this advocacy, but tremendous work was done. And to Bob's point about authorization levels for funding, there was a compromise, and that final House Senate bill almost got through at the end of last year, as he mentioned on his slide. So we have a package. We just need to follow the dots and make sure that with a new chairman in the House, there's ample advocacy and support for moving that same bill through Congress. That's certainly what US Aging is looking to do. The work's been done. They got through it on a bipartisan basis. There's no reason to start from scratch. Just let's pick up that bill, give both sides of the aisle wins, which is never our goal, but ultimately the older adults and caregivers served by this act deserve a win too. And so we're hopeful in that sense in 2025. I think we can avoid any bumps in the road if we look to the great work that was already done on a bipartisan basis in the Senate last year and at the end of the year with the House.
It looked to me for 1 second like Bob was going to say something there, but no. All right, it's all right. I've got one more question. We have time for at least one more. Okay, the Older Americans Act is not a means-tested program, right? So actually, this is another thing that might not be always clear to folks. So how do we know if Older Americans Act supported services reach the older adults who really need them? Abby?
Oh, I'd love to take this one. There is some really interesting work that is being done by states with their aging networks to take a deep dive into who is receiving these services. And I can think of a couple of states that are making sure that that the services are going to the intended population, and then taking that a step further to follow these individuals, see how long we're able to keep them in their homes and in their communities. I think it is a very important point, and I really appreciate whoever brought it up, that the Older Americans Act is not means tested. And we are not a medical model. So if you call in and you tell us that you have Alzheimer's, we take that for face value. We're not going to go and pull medical records at all. What is important in this conversation too is knowing how your state defines, and your area agency on aging, how they define greatest social and economic need, because that really is going to determine within those who are 60 and above who we're trying to target for those programs and services.
That last point is very important, Ronnie. That's in the law, okay? Targeting the greatest, not the semi-great, the greatest economic or social need should be emphasized.
Excellent. Great points. Okay, Bob, I got one for you. This is a question about whether you expect the One Big Beautiful Bill's changes to SNAP. Again, this is about sort of like shifting across different programs, especially the extension of the work requirement and reporting requirements to people at older ages to increase the need for Older Americans Act nutrition services.
Absolutely. Absolutely. Because again, some of the same populations that are being talked about in the greatest economic need are the people who are receiving SNAP, okay? And you have a program that only recently started to reach the point where more than half of older adults who are eligible were actually signing up for SNAP, okay? And now you have this complication thrown in about work requirements, recertifications, things of that nature. I think the combination of these SNAP cuts and these cuts to the food banks, which Older Americans Act nutrition programs have a wonderful relationship with our food banks around the country. This is going to have a real live impact on our programs in the Older Americans Act. And this is why we have to be focused on why there's an increased need for funding, because when demand grows, as it will, you know, that's how you accommodate demand, is to have adequate funding to meet that demand. And I think now we have to really be conscious of this going forward. And I hope that we're able to do that in the appropriations process for the fiscal year 26.
Well said. Thank you. I got a closing question. It's going to be kind of a lightning round because we're right up near the end. And so for each of you, what is one action in support of the Older Americans Act that you'd like each of us, all the folks in the audience, to take?
Well, I am going to echo Bob's point of if you don't know these programs and services, it's not enough to just listen to us talk about them. Let's go find the organization that is actually delivering these programs and services and go do a meal ride along, go to a senior center, go and see some of these supports and services put into work each and every day. And then I guess the other part of that is the only way that you'll get to do that is if you start to get to know your network. And I know all of us on this webinar would say if you ever need any help with identifying contacts in your network, please reach out to us. We would love to make the contact, make sure that you're able to get a better understanding of these programs put into service.
Fantastic. That's a good one.
And I would just drill down. Didn't have time to cover what's sort of unique about area agencies on aging and their planning and development of services versus that final step, which often happens in the community with their community providers. So I would urge folks not to overlook that because there's a lot that happens behind the scenes that are not quite as picture perfect for a congressional visit. But without those behind the scenes information and referrals, the case managers going into homes and on calls, you often can't bring a member of Congress along on those visits because of privacy issues. So I really would urge anyone who is excited about the Older Americans and want to dig in to go to our website. We have some materials not only on the basics of the Older Americans Act to dig even deeper, but also on the specific role the area agencies on aging play. So I got to earn my paycheck here, Ronnie. So, Bob?
And I would just close by saying I would appreciate those who are on this webinar to understand there's a difference between an expenditure of dollars and an investment of dollars. Okay. The Older Americans Act is a dynamite investment and has been for years. And now it's time to demonstrate that by supporting adequate funding and not look at that as an expenditure. It is an investment that actually saves taxpayers dollars.
Bob, we can always count on you for that pithy, strong ending. Thank you.
Sure.
All right. So as we end, I want to thank Amy and Abby and Bob for your time, for your insights, and really for your fantastic expertise. And then I also want to turn it back to the audience and thank all of you who joined us today. We're so grateful for your interest and for your participation. All of us at the John A. Harper Foundation are always willing to be a resource for you as well, in addition to these fine people. A recording of this event and links to resources will be emailed and everybody to each of you and will be made available at our website, which is johnahartford.org. So we'd love it if you would complete a brief survey about the event. The link is in the chat and we really use them. We really do pay attention. So I'm going to end with this. All of us can do our part to improve care for older people and create what we call a more age-friendly society for our parents, our grandparents, our loved ones, and even our children as they grow up. Thank you.